We also have doctors who volunteer their time in specialty areas such as internal medicine, um, endocrinology, hypertension. We have a dermatologist now who comes in and provides service. And every visit that someone comes to the clinic only costs $25. So that is their out of pocket. If we run any labs, there is a cost for the lab, but those are reduced based on a donation from the lab organization by providing us services at a reduced cost. So we pass that reduced cost on to our patients.
Okay. Well, that sounds great. I know healthcare can get a little out of hand at some points. So, what is the biggest healthcare need that you see in this area?
Really, it's individuals that have chronic conditions like high blood pressure or diabetes that are not getting it seen by a doctor because they don't have the means to do so. And when you allow a chronic disease to go without medical intervention, it becomes emergent. And so we do our best to ensure that people know that we're here to provide the service so that maybe we can keep them out of the emergency room. That's our goal, and to keep them healthy by learning about the disease that they have and understanding how to treat it, and then being able to see a provider on a regular basis to manage that chronic disease.
Okay. When did you guys get started as an organization?
So we opened our doors in 1992. So we are 34 years old. And we were started by a community of really generous and forward thinking individuals who realized that healthcare, that there was a gap in healthcare for individuals that didn't have insurance. So this was in 1992. And if you think about it, nothing has changed in all these years. There are still individuals who don't have healthcare, don't have insurance. And so the healthcare they need, we need to provide. We were started by a doctor, Dr. Weldon Rainwater, a nurse, Flo Jones, and a pastor, Dr. Emil Williams. They brought community leaders together, almost 50 individuals, to start our organization. And interestingly enough, we still continue today, 34 years later, with the exact same mission and the exact same focus. We haven't changed in those times. Even though insurance has changed over the years, we still remain focused on individuals who don't have insurance because that has remained a constant since the 90s. And so we're just really here to provide compassionate care to individuals who need it.
Yeah, and that's very true. Things are constantly changing every single year with healthcare, and that's amazing that since 1992 you guys have not changed a thing on people, and they know what to expect year in and year out, and in
That's
this
exactly
community.
right. And some of our providers have been around for majority of those 34 years. And we have volunteer providers, we have nurse practitioners, we have a clinical staff that help us meet the needs of our patients. We're open Monday through Thursday from 8 a.m. to 3:45 p.m. We ask that people make an appointment if they can, but we will accept walk-ins if we have availability on our schedule.